Well, greetings, friends. Danielle Smith here. It's been a while since we did a podcast together, but I thought it was important since I did a major announcement in the last couple of weeks about how we might be able to transform healthcare. And I want to give you a bit of a context to this one because I had the idea for health spending accounts for some time. And part of the reason for that is that I have looked at the Canada Health Act over the years, and I've looked at healthcare policy probably going back to 1995. No kidding. That was when I was an intern at the Fraser Institute. And there was a waiting your turn health survey. And in the waiting your turn health survey, it basically just asked doctors, how long does it take when you see a patient for you to get them a referral to a specialist so they can receive treatment? And then the specialist was asked how long between getting a patient before they actually get their treatment, and they've been keeping track of all of these weeks. And sadly, over 27 years, we have just seen nothing but a growth in those lists, even though we have now probably not just doubled. I think we've quadrupled the amount of healthcare spending we've had in that period of time. And so I've watched that with some great frustration, wondering, gosh, what does it take? Why is it that no matter how much we put into the healthcare system, we seem not to be able to get more results? It's been in the last few years that I've started using some of the alternative practitioners. And one of the things that is interesting about the Canada Health Act is that they only require, then the principles are these. You have to have public administration. So it has to be a public insurance program as opposed to a bunch of different private insurance. It has to be universal. And I think it is universal. It does cover everyone. But the other three where I think there's some questionability is it's supposed to be portable. I'm not sure many of you find it portable. If you are trying to get service in the rest of the country or even outside of country, I don't think you found it to be portable. It has to be accessible. The way politicians look at accessibility is that you're not allowed to pay anything out of pocket. But the way the courts look at accessibility in the Shalley decision that came down a number of years ago was they said access to a waiting list is not access to healthcare. And yet we continue to have these massive long waits. I was actually incorrect in my newsletter about this last week. It's not 40 weeks that most people I talk to are waiting for a knee or hip replacement. It's 40 months. Can you imagine? 4 years waiting for treatment. And then, of course, the final area is comprehensiveness. And that's been a bit of a puzzler to me because we don't really have a comprehensive system. Now, do we? Because all we seem to cover is the physician services. You go to a family doctor, that gets covered. And you go, if you get to a hospital and you need to have a service in a hospital or a major surgery that is delivered in a hospital, that's covered. But there are a whole variety of healthcare practitioners that are outside those two categories. So here's my thinking, friends. If we want to make the system truly comprehensive, shouldn't we create a mechanism to cover everything? So shouldn't we have a mechanism to cover all the things that are currently covered by health spending accounts for those doctors or for those professionals and those employees who have them? I feel like I need to do just a little more explaining of this one too, just in case. I don't want to leave you guys feeling like I haven't filled in all of the blanks. So if you haven't had a health spending account before, the one that I had was the only time I had it was when I got elected last time around. So I was there for 3 years and it was $950. And the reason they gave us that is that they give to politicians the same benefit that they give to their frontline service providers. So I've been told that not every public servant has a $950 health spending account. Sounds like there's some variation, but that's what some do have. And what it allows them to do is just take that $950 and pay for all the things that are not covered by the public health insurance. So you can think of them just off the top of your head. You can talk about dentistry. You can look at if you've got a care attendant that you need, that is also can be covered by a health spending account. If you've got different types of equipment that is not covered, you can cover it in a health spending account. Most of us have pharmaceutical plans, but there are co-payments. The pharmaceuticals can be covered by a health spending account. And then all the variety of practitioners. So chiropractors and physiotherapists, massage therapists. We've got nutritionists, dietitians. There's also a nurse practitioner category that I understand has trained to the same level of a doctor, but they can't build a system the same way that a doctor can. And of course, naturopaths. So My thinking around it is this: is we keep talking about how the crisis of getting healthcare to individuals, and that we're not able to attract as many family doctors. And so, if we were to broaden it out and share the load, as it were, could it be that we could put less pressure on our conventional medicine, our doctors, and in turn put less pressure on our hospitals if we started funding some of those other practitioners that are focused more in the area of prevention and wellness? I want you to understand that's where I'm coming from, because it's not instead of, it's in addition to. I kind of think, and maybe this won't surprise you, knowing my history, I kind of think that every piece has a part to play, and I'm not sure I fully understand. I'm sure I will after talking to my guest. I'm not sure I fully understand why it is there's such divisions between traditional medicine and all of these preventative types of medicines. But I would put it to you that more and more people that I know are using these types of practitioners to keep themselves well. Let me link it to one other policy that I have been campaigning on. Also, I've told you that we will not have lockdowns again in the fall. And the reason for that is so many of the people I know who are in favor of vaccine choice, it's surprising to me because I know they've been mischaracterized, but the ones who are in favor of vaccine choice, I find also disproportionately tend to be all using all of these alternative practitioners as well, because they believe that they can keep themselves healthy. They are not fearful when we get into respiratory virus season, because they believe they've done the work to make sure that their immune system is strong. And so this is all I'm saying to you. May not be for everyone, but the fact that an increasing number of people are focused on the wellness side of the equation, that causes me pause and makes me wonder, if we want a truly comprehensive system, why don't we create the same kind of mechanisms that are available to those who are in large companies with a health spending account, in public service? Why don't we make that available to everyone and just see if we can get a healthier society? So, joining me to talk about that, I wanted to make sure Christine had managed to hear all of the context for why I wanted to have her on today, is Christine Perkins, and she is a naturopathic doctor. I think I went to a naturopath once, but it wasn't but maybe I'm surprised I haven't actually gone to one more often, because I do tend to be of the same view of keeping myself well. But I think I need to know a little bit more about your profession, understand a little bit more about the conflict or perceived conflict. Maybe there isn't the same kind of conflict that there used to be in the past,
Mhm.
but I want people to understand how they might be able to use your services and how it might differ from conventional medicine. But thanks so much for being with me today.
Yeah, thank you for having me. I'm excited to be here.
Now, do I call you Dr. Perkins? Having been trained as a naturopath, do you have that title?
Yeah, we do. We have title protection, and we can call ourselves doctors of naturopathic medicine, naturopathic doctors, naturopaths, and other people cannot. So if you saw someone that called themselves a doctor of natural medicine, that would not be a naturopathic doctor,
Hmm.
not necessarily regulated in our province. We have a college of naturopathic doctors of Alberta here. We're regulated just like our College of Physicians and Surgeons regulates medical doctors. So we have that protection for the public, and we're all very highly skilled and educated, having to pass licensing exams and everything else that the mainstream model has to pass as well.
Let's talk then about what the training is for a naturopathic
Yeah.
doctor,
So
because you put a lot of years of school into this.
we do. It's between 8 and 10 years. We do 4 years of university pre-med studies, and then 4 years at one of the regular or regulated colleges. We have two campuses here in Canada, one in Toronto, and a sister campus of the Canadian College of Naturopathic Medicine is in Vancouver. It's called the Boucher Institute.
Hmm.
And then I think we have about 4 or 5 in the United States that are you can be licensed from. And so those are the schools that we go to. And then now some of the graduates choose to do residency programs. They didn't exist when I was graduating in 1997, but they have residency programs now where you can specialize in, we call it focus, not necessarily, we don't have specialties as naturopathic doctors, but they can focus in maybe cancer treatment, or they can focus in another area like pediatrics or something like that, a practice that has that kind of feel to it. I'm a general practitioner, and most of us are, but we do often, we're all very different. It's like I like to say, it's the beauty and the nemesis of us. We're all very, very different. So some of us practice only IV therapy. Some of us practice only one other, another type of therapy. We're very diverse in our therapies, but the principles by which we're trained by and how we evaluate our patients, that's very standardized. That's the curriculum is very standardized in how we are trained to analyze, diagnose, and we are primary care practitioners. We are allowed to diagnose our patients and treat their diseases that we diagnose in this province.
Talk to me about the regulatory environment. So you said that there's certain types of professions that aren't regulated, but yours is. How long have you been regulated for in Alberta?
I hope I'm going to get my numbers right, my years right. I believe in 1993 in Alberta, or sorry, 1933 in Alberta, we lost licensure for naturopathic doctors. And at the time, it was because there were only 2 naturopaths in the province, and they let the licensure slide. I moved here in 1998 from Ontario, and we were right in the early midst of gaining our licensure again, which I believe came through in 2012. So we were self-regulated. We were the Association of Alberta Naturopathic Practitioners at that time, the AANP, until we became regulated, in which time we had a college that was formed, and we are regulated under the Health Practitioners Act here, along with acupuncturists, physiotherapists, medical doctors, surgeons and physicians, nurses. We're all under that same umbrella act. The one type of therapy that I know of that isn't necessarily regulated at this time is massage therapy in this province.
Yeah, and I think that's I'm hoping that they do end up getting regulated, because I think that was one of the big problems during COVID, is that they were trying to give fewer restrictions to the regulated health professions, and massage therapy was when they had to make a specific exemption because they didn't have a regulatory body for this. So I talked to some of the folks in the massage therapy world suggesting that maybe they should try to get a little more formality to their profession.
It takes a long time, though.
Yeah. Oh, really?
It took a very long time for us to get our licensure back, like many, many years of lobbying the government and meetings with lawyers and writing the act and getting everything in place. It took several of our naturopathic doctors contributed heavily. They're legacy kind of doctors now that contributed heavily to getting that put into place for us. But it took, I'm going to guess that it was thousands of man hours to get that put together.
What do you think the reluctance was? Because I find that interesting that your profession has been around, obviously, for more than 100 years.
Yeah.
Did not have formal recognition for quite a long break there, and then a pretty big fight to try to get regulated. So that suggests to me that there is a little reluctance.
Maybe we had a lot of support, I remember, from the pharmacists, because part of the process is once you start that regulation, all of the other colleges get to comment on your process coming forward. We didn't really hit any stumbling blocks with that. There wasn't any college that stood in our way. It's simply the nature of the process that it took that time. And I think the rotating government every 4 years really inhibits us. We just get to know the minister and start lobbying for what we want to see happen next. And oops, there we go again. Now we're getting to know somebody new again. And I believe that actually stands in our way more than anything.
Okay, well, that's good to know, because as I'm talking with massage therapists, I want to make sure I understand how we might be able to remove some of the roadblocks. So thank you for that. So then let's talk a little bit about the philosophy, because you could have gone conventional medicine and you chose not to. So just in broad brushstrokes, tell me the difference between the philosophy of a conventional doctor versus a naturopathic doctor.
Well, from naturopathic medicine, the principles by which we practice, the first one is based on not harming the person. Basically, it's do no harm. So everything we do, body work or therapies that we use, work in conjunction with the body's own natural its own natural abilities, and we kind of facilitate or help that body to heal itself. The person is actually doing the healing itself. I'm not doing any of the healing for my patient, but I'm giving non-toxic doses of natural substances or body work that will stimulate that healing response in someone. We also look at our patients as individuals and not their diseases. So having, when you go to your doctor and you have a subset of symptoms and they can categorize it and give it a name, it sometimes helps. It takes the fear out of what do I have, or I don't know what I have, what's going on. But for some people, it labels them and
Hmm.
they become that. And it becomes like this almost a stigma for them, and they have trouble overcoming that disease. And we look at people as people. They express certain symptoms. My patients show up, I treat them as people with a group of symptoms, but I don't treat a disease. There's no recipe cookbook medicine in naturopathic medicine where we go, oh, they have diabetes, therefore X, Y, and Z are given. Each patient is given that individualized treatment. Some might have the same things, others might go away with different things, even though they've been diagnosed with the same condition. We look at the whole person as well as naturopathic doctors. So we want to know everything about you. We want to know even about, your childhood infections. We want to know about whether you've had dental problems. We want to know about your motor vehicle accidents, because it all contributes to how your body functions. And we want to be able, if possible, this is another principle, to treat the cause. A good example of treating the cause is, let's say someone has a magnesium deficiency and they've got all sorts of cramping in their body and they have anxiety in their body. They have, I'm trying to think of all the other things that would go, constipation maybe. They've got all these symptoms and they could all be related to a magnesium deficiency.
Huh.
So we want to look at the whole picture so that we can see if there's something that's missing in the body and treat the cause. And sometimes we can't treat the cause either, Danielle. Like sometimes if someone has a lung cancer, for instance, the cause was smoking 40 years ago. I can't remove that cause. What I can do, though, is support them in the process that they're going through with chemotherapy or radiation or other therapies that might give them a better quality of life and might extend that time as well.
It's interesting to hear you say that, because I was surprised to learn of this new, I don't know if it's a new field of medicine or maybe just a new label. I've met two integrative medical practitioners in the last number of months, and it's almost like they bridge between the two. So they will
They are
use
very
some of
much
the
like a bridge.
yeah. So maybe you should tell me, because I don't want to misapprehend what, or misstate what an integrative medical doctor is. But it seems like they draw from both worlds. If you need conventional medicine, then you go that route. But if you can be supported with natural medicine, they do that. So tell me about this. Is it an emerging field?
It is for some. We have several in the city that I absolutely adore how they practice. They're more holistic and they integrate. That's exactly what they say. They integrate mainstream conventional medicine with some alternative therapies and some different types of testing as well. They do take extra training in functional medicine for that, which can take them several years to do. It's very comprehensive, that training that they take to become integrative or functional medical doctors. Many of them prescribe things like natural hormones for women or bioidentical hormones for men and women as they go through andropause or menopause, which have been shown to be a little bit safer. At least we think that they're safer than maybe regular regular hormonal replacement therapy. So there are some things that they use that are more natural, that have less side effects and potentially the same outcomes. And they are focused and specialized in that. So they have access to the pharmaceutical world that I don't have. So when we began becoming relicensed in Alberta, I used to prescribe bioidentical hormones. I used to have prescription rights for that with the pharmacy, but they got taken away from us and were removed from our scope of practice under advice, I believe, as we began that process of becoming licensed again, all knowing that if that became something that naturopathic doctors wanted in their scope of practice, we could apply for it later and have it added again. It's just proving to take decades to get that done.
Really?
And it's one of the things when, maybe we can discuss at some point. I think it is a point that would be wonderful to see naturopathic doctors have access to that again. It would be wonderful to see our scope of practice be able to be expanded in things that we are trained to do and have done in the past. And I'd also love to see us have access to net care. We need to work together. This is sort of the thing. We look at the body and see it in perfect balance when a person comes to see us, even though they have horrific symptoms sometimes, and it's the symptoms that bring them to me. I look at them and think that body is in balance based on what they're missing, based on their toxic levels, based on their exposures, maybe their traumas, whatever it is. That body's in perfect balance for what happened to them. If I can correct deficiencies, or if I can help remove some of the obstacles to their body with healing, that's great. But sometimes they need a lifeboat too. Sometimes they need a medication. Sometimes they need a surgery. I've recommended my patients have chemotherapy before because the benefit from it outweighed the risk and it made more sense. And so we need to work together to get the patient to have the best outcome possible.
That
And
makes so
that
much
means
sense.
so it means we look at prevention, whereas mainstream medicine doesn't necessarily deal with prevention. Another
Why
good example.
doesn't mainstream medicine look at prevention? Can you maybe talk a little bit about the different philosophy? You had a term for it when I asked you off the air about what the difference was between mainstream
Being heroic.
medicine. Yeah,
Mainstream
heroic.
medicine is very heroic medicine. I mean, they look at you and they see you as being in need of a rescue, of heroic medicine. And quite frankly, if you got in a car accident, you need heroic medicine at that moment in time. But a lot of mainstream medicine is just managing diseases. They're not actually helping remove that underlying issue that's preventing that body from curing itself, which is what naturopathic doctors do. So if you get cancer and you have a tumor that needs to be removed, that's a mainstream medical thing that needs to happen.
Mhm.
And at the same time, why did you arrive in that state? What happened to that body? What happened to that person? We need to look at the underlying reasons they got there and look at prevention and treat them for that so it doesn't occur again. So do we need both forms of medicine? We actually do. We need both forms of medicine.
That's a perfect example because
Mhm.
absolutely, once you've arrived and got stage 4 cancer and there's radiation and surgery and chemotherapy, that's an incredibly expensive intervention, not
Totally.
just for the system, but also expensive in the toll it takes on the body. But when you think about everything that built up before you got to
Mhm.
stage 4 and that diagnosis, that's completely within your control. And there's something that you can do about that that is different. So, and I
Yes.
want to talk a little more about that.
Sure.
So, first of all, tell me if I was to come to a naturopathic doctor for a first visit, tell me what the experience would be like that might be different than going to a traditional family doctor.
Yeah, sure. Usually my first visits with my patients, and they should be most standard practices, they're about an hour long. You sit with your
Mhm.
naturopathic doctor and go over your history. You talk about the things that you deliberately came to see the naturopath about. Sometimes it could be, actually, I'm seeing quite a bit of anxiety and depression these days following the pandemic. So that's a really big issue. We talk about the way a person, experiences that because everyone's a little bit different. We might go over their diet because oftentimes diet impacts what they're doing, in their lives. Two of the main triggers in my profession for anxiety are caffeine and sugar. So we might talk about how much caffeine that person's consuming and how much sugar they're eating. Um, and we often slip into the whole idea of how addictive sugar is and that kind of whole. So these conversations are a little organic the way they take place. And we start down one path and we do a thorough history with our patients. But sometimes we veer off a little bit and discuss some of the therapies where I'm always formulating in my brain a plan for them as they're talking to me about their history and their chief complaints. And then we do a physical exam. So, and sometimes it's just a general physical exam. Sometimes it's very specific. If someone comes to me with abdominal pain, I may only do an abdominal exam just to make sure that I don't miss something or I don't miss that they need a referral somewhere. So it's very comprehensive, your time with me in your first visit. Then we formulate a plan and I explain the plan to my patients. I tell them what I think they're dealing with, what the underlying cause might be, how their lifestyle is contributing to what's going on, and explain it a little bit. In fact, I tend to be the naturopath that gives way too much information. My patients come out and I usually have to say, here's my email address. Please email me if you have any questions, because I don't want my patients to just take my advice and go, yes, Dr. Perkins, yes, I'll do whatever you say. I actually want them to say why. Why do you want me to do that? Because they have to take responsibility for their own healing. We are all personally responsible for our own health. So, when it comes to doing my part in the pandemic, my part was to make sure that my vitamin D levels were optimal. My part was to make sure that I didn't eat sugar because sugar suppresses your immune system. My part was to make sure I physically exercised almost every day if I could. And I took some fantastic courses. I love my fitness trainer, and he often focuses on this. So my mental health was taken care of and my physical body was taken care of. Those are things that are in my personal control. Now, as a child, I couldn't help some of my exposures. Maybe one day I will have a disease that requires mainstream medicine to intervene. And I'm so glad that it's there. But I think it's a matter of integrating both of them together. You know, I don't know whether the medical profession will ever kind of fully adopt functional medicine. I think there'll always be certain medical doctors that are drawn to that and will become functional medical doctors. like another difference in our training, as I'm talking and I think about it, naturopathic doctors probably get more than 200 to 300 hours, and I might be shy on that, of nutritional training
Huh.
in our degree. Mainstream medical doctors get about 20 hours of training in nutrition, and that includes the introduction of solid foods and breastfeeding. So they don't actually get a huge amount of training in how to deal with diet. Naturopathic doctors do.
That's the,
So,
it's so interesting to hear even just you going through that, because when I think about some of the self-care that people are going to need post-COVID,
mhm,
obviously we do have undiagnosed cancers. We do have people who've had conditions that have deteriorated. I talked to Dr. Raj Sherman. He came to a couple of events, and he's an emergency room doc in Edmonton. And he just said there's a lot of people who just didn't go see a doctor over the
mhm,
last
that's
2 years.
very true.
And as a result, their actual conditions have now deteriorated to the point where they need hospital care. And so I'm trying to think of whenever I've gone to a doctor, I don't think that we've ever had a mental health discussion.
Mm,
I don't think we've ever had a nutrition discussion, or are you getting enough sleep and exercise discussion?
true.
But I,
Yeah.
I I have this Calm app. I love it. And one of the doctors that I love listening to on it, Dr. Chatterjee, he talks about the four pillars of health.
Mhm.
And one of them is making sure that you do not have stress, and that you're meditating and you're keeping yourself relaxed and not anxious. And then of course it's nutrition, it's movement so that you're not sedentary, and it's getting proper sleep. And I'm trying to build that into my life as well. But it's interesting to me that your philosophy kind of aligns with all
It
of
is,
that.
because we're treating the whole person. When we look at the whole person, it all interacts. There's no hyphen between mind body. I mean, yes, we hyphenate it when we write it, but in real life, that mind body is completely integrated together. What you experience, and I'm sure you felt stress in your life. I have. My heart races a little bit, my hands might get clammy, my muscles get tight. That's a physical response to something emotional going on. Those hormones like cortisol and adrenaline that get
Yeah.
released during stress have a physical impact on us, and they're not good ones. They'll help us rescue ourselves, they'll get us out of a jam, but they're certainly not good for us to be exposed to long term. So I spend a great deal of time with my patients talking about just what you said: meditation, movement, proper nutrition, and trying to be to de-stress, to find ways, either yoga. I teach and practice Kundalini yoga as well. So it's my method that I use to help patients deal with stress. But we have to have a method to do that. And it can't be alcohol or an addiction, because those aren't going to help us in the long run. We actually have to have someone guiding us, I think, in some of these ways. And your naturopathic doctor is one of those people that would do that, because we're trained to look at the whole person and to treat that entire being.
It seems to me that we almost need to have both, that you
Mhm.
need to make sure that you've got a conventional doctor in case something has manifested and now you need to go down the track of intervention. But it seems to make sense that we would all want to have a naturopathic doctor as well to keep us from getting to that point.
True.
I don't know why I'm having this revelation. I'm 51 years old. I'm not sure why I'm having this revelation now, but why wouldn't that be some of the messaging? If you're already regulated, so you've got the affirmation that people can feel comfortable knowing that if there's a
Mhm.
problem, that it's regulated through a college. So
Yep.
it seems like we've already gone through and made the regulatory steps to affirm that you're
Yeah.
a part of the healthcare system, but nobody talks about you. Why is that?
Yeah, it's sort of, I remember moving here in 98. I was the 14th naturopath in the province. There's now over 280 registered in our province. So it's become more common knowledge. But I also remember, like, at that time, I'd get introduced to someone and they'd say, the next question usually when you're introduced is, so what do you do? Like, what's your job? And I'd say, oh, I'm a naturopathic doctor. And they'd go, a what? So
Hmm.
education is part of it. Maybe the public just isn't educated about us. There's been a long-standing misunderstanding or myth that maybe naturopathic doctors aren't scientific, or I have been called a voodoo doctor in my lifetime. I have been called a quack in my lifetime, because some of the things we do don't always, they are clinically and I have clinical experience. I have clinical data that would say they're beneficial for someone, but the science might not support
Mm.
it. And science is usually about 20 years behind. Like when I was in naturopathic medicine, we'd really started like learning 25 years ago, 30 years ago almost now. We were starting to learn about gluten diets, about the gluten in the diet and how detrimental it was, and more from an exposure point of view, as well as celiac. Celiac disease was just starting to kind of be diagnosed 25 years ago. In fact, I had one of my colleagues that sat with me. She had celiac, and none of us had ever heard about it before. So we had started understanding or looking at the effect of foods on our bodies long before the science came out and said, gluten is a problem for a lot of people. And there's a whole spectrum of problems with gluten. It's not just celiac disease. There's like gluten intolerance where you might just get a gassy or bloated. There's also gluten allergy where you might get full-on hives or throw up. And then there's celiac disease, which is an autoimmune disorder to gluten. So we've been practicing things for 20 to 25 years that science is just starting to support. Like vitamin D, for instance, is another thing. Naturopaths have promoted the use of vitamin D, especially in Saskatchewan and Alberta, where we have the highest rates of deficiency in our country. We've been doing that for decades compared to now the science is really coming forward on the benefits of having vitamin D.
Can you talk to me about that? Because I have learned more about vitamin D in the last couple of years of COVID. One of the stories that stuck out to me was a Spanish study where they looked at the
Mhm,
patients who had been
mhm.
hospitalized and found the vast majority of them who had been hospitalized due to COVID were
Yeah,
deficient in vitamin
yeah,
D. It got me thinking, well, why aren't we making sure that we're testing on
yeah.
vitamin D? And if anybody was short, that we're shoring them up. I have a doctor who says the reason we don't test on vitamin D is if you live north of the 49th parallel, you're guaranteed to be deficient in vitamin D. We
But
probably all have a
the
problem.
problem with that philosophy of just because you live in a certain place, you should have it anyways because you're deficient. The problem with that is there's actually a sweet spot in your blood levels of vitamin D that you should be in. So you could be on the very verge of deficiency and you wouldn't know it unless you tested.
Hmm.
And I want you in the sweet spot. I want you much higher on the level and in the sweet spot where there's this certain amount of vitamin D, somewhere between 125 and 100 or 225 nanomoles per liter, is in your bloodstream, and that's beneficial. But if I don't test, I don't know. So to
Are
test,
we able to test? Because I don't know.
it
Again, it's just
costs money.
it's one of those things. I didn't know if getting vitamin D testing was very common, or if we had to. Because I think iCore Blood Services
Yeah.
had set up to start doing vitamin D testing. They've just told me, unfortunately, that they're because of the restructuring, and so I think it sounds like they're going to have to do a new business model. I'm not sure if vitamin D testing is going to come back, but where would you get vitamin D testing done?
You can get it done at Alberta Precision Labs. Like you
Oh, you
can get
can?
it done at, yeah, we order it. I order it all the time. You just have to pay for it. So
Uh-huh.
about maybe 10 years ago, there was a really, maybe 15, it was somewhere in that time frame where we began mainstream medicine started picking up also on this idea that vitamin D deficiency was very detrimental to people. And many people were tested. And I thought, wow, this is fantastic. The doctors are now testing and it's so much easier. The access is so much easier to this test. And then everybody was being tested, and it's a $110 test. And they got their wrists slapped. From what I've been told
Oh,
from my medical doctor friends, they got their wrists slapped and they were told they couldn't order. And now, even when I tell my patients, tell your doctor that you've been taking 10 to 15,000 units, international units of vitamin D per day for the last year, and you want to make sure you're not toxic, tell your doctor that and see if they'll test for you. And they still won't.
they still won't.
So I
Can you pay out of pocket for that test?
yeah, yeah.
$110?
Yeah, we
Okay.
just order it for our patients. They pay. I don't overbill, like super bill my patients on that one. Whatever I get billed by Alberta Precision Labs is what they pay me. And many people like to know. So they want to know yearly what their vitamin D status is.
What is the consequence of being low on vitamin D? Can you tell me the reason why that's an important indicator for you, especially as we're going into fall respiratory virus season?
Well, it does have quite a significant effect virally. It really increases something called interferon gamma, which really helps block viral replication. So you can, if your vitamin D levels are adequate, your body will have a mechanism inside its immune system to block viruses from replicating. And so having your vitamin D status adequate at this time of year and moving into the fall and winter is a really important thing. And this has been well documented and well documented among many, many different viruses. It also boosts your immune system in the sense that it fights cancer. We know that at least a minimum of 4,000 international units, from what the studies show, can significantly reduce the risk for certain cancers in people. I too liked the Spanish studies that were coming with COVID and the studies coming out of Spain. They were loading doses quite high in patients for about 7 to 14 days and had tremendous, between 79, if my numbers are correct, it was between 79 and 83% reduction in mortality rate with these sorts of things. And it's a simple supplement that can be easily tested. And this is where, naturopathic doctors can take the burden off of the system so much. Medical doctors have a lot to deal with. There are a lot of sick people. Like you were saying, there's a backlog of people. We can't get people in for surgeries. We can't get people in for testing. We can't get these people that have not seen doctors that needed them for the past 2 years are now coming forward, and they do need pretty serious help. This is where naturopaths can help with prevention and keep people well and keep the burden off of the system. We need to sort of share the load a little bit, and we're here to help as in the healthcare system.
So tell me how much it would cost, because this is the other barrier, I think, is that we have created this situation, I think, where people are allergic to spending any of their own money on their own healthcare. And I think there's this attitude of, well, if I needed that vitamin D test, or I needed to go to a nutritionist or dietitian or a counselor, my doctor would prescribe it for me. And so I think there has been a little passivity, if I may say, on the part of patients in taking charge of their own healthcare. But part of that barrier is dollars. We all have limited dollars, and people just don't want to have to pay out of pocket if they don't have to. This is part of what I'm trying to do with the health spending account, is just give people a little bit of a push so that whatever it is they may need, if they need a naturopath to get them once over, or they need to go see a dietitian, or they need to get some counseling services, now they at least have access to get that type of service. Really? And we don't want the money to be a barrier. It's funny, I keep getting two different reactions. One is, why are you spending money on this at all? And the other is, $300, that's not going to be nearly enough, but $300 is better than nothing. And
I agree.
So hopefully
and you
we'll
have
at
to
least
start
get started.
somewhere,
Completely.
right? You have to start somewhere. And if my fee is $250 per hour, many naturopaths are within that, somewhere within that 200. I know naturopaths that have quite a focus in sort of very advanced technological naturopathic therapies, and their fees are in the $300 per hour. We don't have our college guides us and says we should be between this range and this range, but they don't have like a set fee for naturopathic therapies or naturopathic care. So that being said, a $300 fee, it is a beginning. It's certainly maybe not the answer to the whole picture. But again, it all comes down to this. To me, there are a couple of key words that you've used. You've used accessibility, and this gives people accessibility to something that they may never tried before, that they say, I can't afford, or I can't do it. I mean, it might even give someone money that they can go get a tooth pulled that's been infected for a little while and they don't have any dental care. There's so many things. It is just a scratch on the surface though. But I also talked to my fitness trainer the other day, and you can get, with him, you could go have 20 visits with him. You could have 20 sessions with him on that money. And imagine where you'd be at 2 times a week at the end of 10 weeks. Imagine where your physical health would be, like, and how much your conditioning would change if you could access a physical trainer and do some boot camp classes or some fitness classes with someone like Pete Esterbrooks. Like you actually could make things go a long way, and you would be so much better off, and you're being proactive. And that's the second word, is preventative. So you could, with this money, it's not going to solve the whole problem, but I think it's a start, and it gives people an ability to access what they might not choose to.
What I'm hoping will happen is that by at least putting a little bit out there, then, and if we can create a mechanism where we can allow people to contribute to their own fund tax-free, and then encourage employers to contribute to that fund as well. Now you're starting to create an environment where more money can be spent on the front end for prevention, which I think we must be able to to track if you, I don't know, maybe you have some stats on that. Are you able to give us some idea about how we might lessen certain types of diseases or certain types of pressure on the healthcare system by putting more money at the preventative? Do you do studies like that to show how the two integrate?
If we do, I haven't seen them. I'm imagine that they are there because we are taught that naturopathic, we are taught that it's less expensive and it's less difficult to treat disease, like to prevent disease, than it is to treat it once it arrives. And that would be true, I could probably say clinically, but I don't know if I can. Everyone is an individual. This is the beauty of my medicine too, is that it's individualized. My genetics are different than your genetics, than anybody else's on the planet, and how I process toxins and deal with cancer and deal with viruses and deal with mental health, it's quite different than somebody else. So it makes my job really fascinating. I'm like a little detective all the time, trying to figure out, what person has got this and what person has that. It makes it complicated though, because we don't all fit inside of one box, and one treatment might do great for one person and someone else might need 10 treatments. It's very different. And I can't say, like, statistically, could we say 10 naturopathic treatments prevents X, Y, and Z? I don't know, because everybody's a little bit different.
Right.
Some people may need more, some people might need less. But
and as more people start using services, there might be, we might over time be able to track whether or not that results in long-term reductions in chronic manifestations of disease, which is, I think, what we all want to be able to do.
And I think for me, it's always a matter of the combination. So the patients that do the best in my practice are the patients that use both medicines. It's not one way or the other way. It's that they use both. So it literally is about working together in the health industry as mainstream conventional medical doctors and naturopathic doctors who are skilled in their technology and their words and their language and the diagnoses. And I know many medical doctors that I do work with, and I refer to functional medical doctors all the time because they have access to the pharmacy, which is another interesting thing, right? In British Columbia and in Ontario, naturopathic doctors can prescribe medication. So I just took a pharmacy exam, and I'm super stoked to say and passed it at 50 years old. I was quite amazed that my brain actually still worked like that. My eldest son is in his third year of naturopathic medicine right now at Boucher, and so in Vancouver, and he afterwards said to me, "Mom, that's like the hardest exam we ever have to pass," they told us. And I said, "I'm so glad you didn't tell me that, because I would have had like a mental barrier on top of all of everything." But if I had a license in British Columbia, I would be allowed to schedule. I would be able to prescribe many medications, and like antibiotics and anti-anxiety and all sorts of medication would be accessible through me as well. So which
would make sense, because right now I'm sounding like if you think somebody needs a medication, now you're going to have to tell them to go to their doctor, and then their doctor will get them a prescription, but that's just an extra layer of cost.
And it's inefficient. I can't tell you how inefficient it is to not have access to net care. So my patients arrive, they tell me they have this condition. Some of my elderly patients don't have access to that. They don't have the My Alberta Health app, so they don't have access to their own laboratory results. So then I have to say, okay, now I need you to go back to your doctor, and I need to look at those laboratory results. I should be able, as a primary healthcare provider in Alberta, to click, and look online and see my patients' labs and know what their last diagnosis was and know what the last prescription was, especially if I'm trained in how to prescribe and if I'm trained in how to diagnose. So it just makes sense, because then what I wind up doing is sending them back to their doctor, and then they have to come back and pay me again. So it's very inefficient, and these things could be solved. Maybe they're not as easy as I think.
Okay, it's on my list. So looking at prescription eligibility, because we do it in Ontario and BC, and also looking at getting access to net care. Well, we've got your wish list of regulatory reforms that are needed. Anything else? Because I have a few more questions that I want to ask you about going into the fall respiratory virus season.
No, I don't think so. In terms of, I don't think so.
Okay, let me use
we did lose one. There's maybe one other thing I could do for my other colleagues. There is a form of therapy called PRP, and it's an injection type of therapy that uses our own blood to concentrate the white blood cells and our immunity that then gets injected back into our bodies. I used it for a spider bite that I had that wouldn't heal, and it worked like that. Many naturopaths use it in joints for arthritis and other injuries. In fact, when I was getting my injection done years ago, Jerome McGinley was coming in. He was a Flames at the time, coming into the same clinic I went to have his in his ankle. So it was used a lot by naturopaths, and and it was recently removed from our scope of practice. And I don't exactly know why, but it's, again, my wish list would be that we had PRP reinstated, we had pharmacy, and we had access to net care.
I think generally we need to look at scope of practice across all health professions. There seems
I
to be
agree.
these arbitrary decisions about where health begins and ends. And if you are trained in an area, my default would be to be more permissive rather than
Yeah,
more restrictive. So that's other good advice.
great.
I do want to jump off something that you
Go
said
for
though before about being able to pass the exam, and what a good thing, because you might have had a mental block on it. But it got me thinking, there's so much health that is related to our mental state of
it.
mind.
Hmm.
And I want people to go into this respiratory virus season with some confidence. I feel
Yeah,
like there has been nothing but a barrage of fear on people for the last 2 years. And I've talked to plenty of doctors and other health professionals who are saying, if you're in a state of fear, that's going to impact your immune system as well, and your ability to fight off any type of virus if you do get exposure. We want people to feel like they got this,
yep,
because we are going to be exposed to all kinds of pathogens and
yes.
viruses, bacteria in the environment. And we can't be in a position where we're living in a state of fear over things that we touch or being exposed.
Mhm.
We have to have some confidence that our bodies can take care of this. So give me some advice going into the fall season. What do you think we should do? What should the messaging be? And
Well, we're not sitting ducks, for
yeah,
sure. We're
yeah.
not sitting ducks. And I said that at the beginning of many of these seasons, that we can be proactive and we have the ability to be responsible for our own health. Our bodies are designed to deal with these seasonal threats, pathogens. Believe it or not, 2 to 3 trillion of your cells are your own, and 2 to 3 trillion of the cells in your body are actually microorganisms. That might make you feel kind of grossed out, but we deal with microorganisms on a daily basis. Every time you eat food, you're dealing with a microorganism. You're breathing microorganisms in all the time. And I'm sorry, this might make some of the germaphobes on the podcast think, oh my gosh, I should be so anxious. But you've got a system built in. We have this beautiful immune system built into our bodies that takes care of these things all by itself. 80% of your immune system is lining your GI system. It's called the GALT system. And when you eat foods, it naturally wants to protect you from any of the toxins that come in or creatures that get on that food. My grandmother used to say we had to eat a peck of dirt in order to be healthy, like as little kids. There were organisms in the soil that were actually helpful for us. We've become so focused on this antimicrobial, or this sanitation and sterilization of everything, that we're doing a disservice to our immune systems. The chemicals that we use do a disservice to our immune systems. So the microbiome, our digestive tracts, are really, really important to have in shape. That's like probiotics. That's like eating fermented foods and taking a good quality probiotic. These are simple things. Making sure your vitamin D status is really, really high. And if you want to have it checked, come see a naturopath and order the test, or a functional medical doctor, and get the test ordered and know what your status is. It's a very inexpensive supplement. I always recommend people take it in a liquid form. This is something else, a little beef in my industry, is that sometimes what's in the bottle and on the label are 100% good, but are they bioavailable and usable in your body? They might not be. So we want to make sure that you use it. So make sure you're taking a liquid vitamin
Hmm.
D. It's
I
much
don't
more
think I've ever
bioavailable.
had liquid vitamin D. Is that easy to get, or do you have to get that from an office like yours?
No, it's available in the health food stores. And I also love Script Pharmacy and Cambrian Drugs. Script Pharmacy in Calgary is one of my favorite pharmacies. They're a compounding pharmacy. They will cater to you. They'll make just about anything I ask them to make for my patients. They're incredibly knowledgeable. And so, yeah, it's available over the counter in those two pharmacies, in health food stores, and just make sure it's a liquid.
All right. Let's
And
talk
then
about, yeah, and continue.
And then your
Yeah.
mental health is really important. Have confidence that if you take good care of yourself, and I guess it comes down to this, the people who did the worst during the last few years were people that had comorbidities, right? And their vitamin D status, we know that the research from Spain is coming in that but if their vitamin D was low and they had comorbidities, these were two factors that we are in charge of or can control. So make some changes in your life. See a naturopath and see if you can change your diet and get in shape. And if you need to lose weight, and seek out a fitness trainer and get in good shape. Like, all of these things benefit your health.
Is there also a case though, because I've heard one of the issues that we have, especially as you get to be quite senior and you get the comorbidities, that the immune response is just not as strong as when you were
Mhm.
younger. I mean, is there a point at which you've just there's nothing you can do to boost your immune system? I don't want to be fatalistic about this, but
No.
is that a reality that just as you age, you get to a certain point where your immune system is not able to be as strong as it once was?
A certain part of your immune system. The thymus gland, which sits behind your breastbone here, is actually it atrophies and shrinks as you age.
Hmm.
And so that is normal. That is just a normal aging physiological process. But we do know that you can live a very long and healthy life and fight against disease if you've got the right factors in place. We call it like epigenetics. As long as what you're surrounding your genes in is good for your genes, healthy for your genes. So that would be limiting toxic exposures and people, I hear from my patients will say, well, my doctor tells me my liver is detoxing all the time. That's true. But we actually live in quite a toxic world. We can't control what's in the air. We can't control sometimes what's in our water. But so we have to do some things to help our body purge those toxins that are in our systems. Sweating is a great way. Saunas, steam rooms, or even just exercise is sweating. You're eliminating toxins that way it's a wonderful way. It doesn't involve supplements. It doesn't involve anything, but just natural sweating works very well. So, and it increases the immune system as well. So getting into that sweat lodge or buying a sauna, investing in a sauna or something like that is a wonderful thing to have for your immune system. But there are all sorts of things that we can do to, once a comorbidity, once you are obese, or once you have high blood pressure, once you have diabetes, which are kind of the top three things that people have, or cancer, once you have those things, it is a lot more difficult to deal with them, but it's not impossible.
Mhm.
Absolutely not. We have some amazing therapies. Like I love using my IV vitamin Cs, IV high dose vitamin C, we call them long viral vitamin C drips, or ozone therapy. We have some really amazing cutting edge therapies as naturopathic doctors available to us that can augment immune response, that can help the body fight pathogens, that can help the body be at its optimal health. And again, remember, we don't treat diseases as naturopaths. We treat people with
Yeah.
symptoms. We have so many different therapies available to us, whether it's traditional botanical medicine, which is where modern pharmacy comes from, whether it's looking at nutrition, whether it's homeopathic medicine, a form of body work. Many of us do different forms of body work, or acupuncture and traditional Asian medicine. Like we have so many therapies available to us as naturopathic doctors that you won't run out of options if you
It's
come.
totally true. I must tell you, I had a neck injury, and I never would have thought I would have tried acupuncture because I just don't like needles, but it's not the same kind of
No,
needle. And
it's not.
I had two treatments, and by golly, it worked. And so this is I think that there's an unfamiliarity, and that's what I'm hoping that we can bridge the gap on. If you had some advice about going into the fall respiratory virus season from the politicians, I feel like politicians do not have these kinds of conversations like I'm having with you.
Mhm.
I do not feel like the environment for the doctors who are providing advice into those who are the decision makers, I don't feel like they're integrating any of the things that we talked about today. I gather that in the UK they have a chief medical officer of health that's a doctor, but they also have a chief nurse and they have a chief
Mm,
paramedic, which I thought was interesting. But
that
I've been
sounds great.
wondering, do I need to have a committee that's a chief doctor, chief nurse, chief paramedic, as well as a chief of integrative medicine or chief of
Mhm,
functional medicine or something
mhm,
along those lines? I'm just trying to scope this out. I just feel like there's this whole area of prevention that's vitally important. As we've already talked about, we've already asserted that they're legitimate, credible ways of getting healthcare. We
mhm.
regulate them. There's a
Yeah.
process. How do we get the kind of things we're talking about into the discussion about healthcare policy when it comes to political decision making? Do you have some thoughts on that?
I do think it's partly education too, right? Like I think there was a heavy, heavy burden placed on very few individuals during the last 2 years about
Mhm.
policies and decision making in healthcare. And it was too much for one person to decide or to make those decisions. consultation needs to happen amongst many people. And I think at one of the times I saw you speak, Danielle, I loved how you talked about making sure that even regionally, we looked regionally at the needs for each region so that certain areas of Alberta wouldn't fall under the same restrictions possibly or problems as somewhere like Calgary or Edmonton, where we have, a crisis taking place. Like, we need to look at each regional, they all need to be consulted. The chief of each hospital needs to be consulted about what their hospital needs. So I just feel like if we had more minds working on things together, we might make better decisions than if we just had one person calling all the shots, or two, however it worked. So maybe opening up the discussion to it. I don't know. Politics and medicine I don't know if they always mix. Like, they're just not, it's not my skill set to be strategic and to be into policy making and that kind of thing. But we all feel the repercussions of it, we all feel the repercussions of it. And I think that I certainly wouldn't have wanted to be in the shoes of the government that made all the decisions in the last 2 years. They had tough decisions to make, and not all of them were great ones. And we need stronger politicians that can have firm convictions, like you.
And also, but also experts like you who are able to be willing to feed into the process as well, so that we have that broader perspective also. Can you tell me what we should be looking for the next few years? I'll tell you what I'm fearful of is that I've been told by doctors that we may be on the cusp of a generational mental health crisis among our kids, with anxiety and fear and division that was created because of some of the messaging that happened. And I want to try to find a way that we don't need to have that manifest over decades. I feel like if we can take some action now to acknowledge that there's things that we've got to address, and then make sure that we've got the supports in place to address them, people can be resilient. I believe I believe in that book, Anti-Fragile, that there's such a thing as post-traumatic stress growth. That doesn't just have to be a disorder. But I want to know what you'll be looking for in your practice, maybe a couple of things that your patients are already telling you about how they're dealing with the last 2 years, and maybe what you're looking forward to be managing over the next 5 or 10 years as we deal with the consequences of what's been of the lockdowns.
Yeah, I don't know what we're going to be dealing with in the next 5 to 10 years. I think it's such a novel thing that we are still boots to the ground for the next 10 years, figuring out how this virus has affected people in general. I technically am also not supposed to discuss this. My college doesn't allow me to discuss kind of COVID with anyone. We followed the public health order, and that's what we were told to do, and that's where it kind of stands. However, we know some things scientifically that we can talk about that are, we know. I just read an article the other day about, actually, I think it might have even been this morning I was reading this, about how loneliness in the youth is leading to more alcoholism and reckless behavior. And so we're starting to see, did the pandemic cause quite a bit of loneliness for these and isolation for these children? Absolutely. Are we going to face maybe some more addictions and some other things? It's very possible. I don't know what we're going to face. I really don't. It's just going to take time for it all to kind of unravel and show us. We have to be prepared, though. This was a very hard time for people, emotionally, physically, financially. It was very hard. What I do know, though, is that connection is what heals. So even people who have trauma, any kind of trauma, you don't have to have the person that traumatized you help you heal. You just need connection to someone that can help you heal. Connection and the bond, like a bond, what's the word I'm looking for? Attachment is necessary for healing. And it doesn't have to be with the person that harmed you or the circumstance that harmed you. So we actually have to come together. We need to come together. We need to not be locked down. We need to spend time together. We need to have those meetings and have heartfelt conversations and share food and be human again to heal from this. So I think it's really important that we focus on that. So even one person at a time, even if a teenager just has one person in their life that can make a difference, it can happen. And so is that a naturopath? Is that a psychologist? Is that, I have I know someone that recently retired from the Children's Hospital here in Alberta, and she had said to me that usually pre-pandemic there were 2 hospital beds for mental health per day being used of the 32, and now there's 16 per
Oh,
day for children, which is insane to me, to say a pun or a very inappropriate one, but that's just awful that we're having to deal with that. And so there are naturopathically, we do have supplementation. When we become deficient in certain brain chemicals, there are ways to build that back up without having to take a medication.
hmm.
Even having had the virus itself, there are certain medications that can help with that neural inflammation that's happening. There are so many pathways that can be taken through the medical doctor, through your naturopathic doctor, through a massage therapist, through touch, through fitness, because actually that's one of the most important. It's the most underutilized and most effective treatment for anxiety and depression is physical fitness. So
I'm going to be talking to the fitness instructors in a couple of weeks because they have
perfect.
some thoughts for me about how they might be able to be included in a health spending account as well.
Yeah,
The way I'm looking at this is that it really is all hands on deck. That if we have a crisis in being able to attract doctors and we've got pressure on our hospitals, let's just then expand out
right.
the other medical practitioners that are going to be able to provide this kind of service. And let's see if we're able to get through to the other side of some of the long-term problems that were created over these last 2 years. Let's see if we can do that by having more voices in the mix rather than fewer. I'm not going to get you in trouble with your college, but
That's
it
okay.
does concern me that colleges have not allowed for their for the people that they regulate to speak freely, because that's also one of the reasons why politicians don't get good decisions, is that if there's only 2 people who are deputized to speak to the media and they have an extreme view of what needs to be done, then we don't get the good advice that we do as well. So I might offline try to get some advice from you about how we might be able to deal with
Yeah,
some of
I
those
actually
issues
have
as
some
well.
thoughts on that too. So it would be good for us to have that conversation. I really just feel like it is about integrating everyone. It is all hands on deck, and it's about everyone helping everyone. And it's about using the naturopathic model that has so many amazing therapies, using massage therapy, using the fitness to help that everybody get back on track, everybody to have that optimal health that they can have. It's not just one thing that delivers health to people, it's many things. And the mainstream medical doctors and conventional medical doctors and surgeons are absolutely needed. And I don't believe not any naturopathic doctor is here to try and steal anyone's turf. We're here to help our patients have the best outcome that they possibly can. They're basically put first, and
Yeah.
we're trying to get them to feel the best. And so we need to all work together, whether it's politicians or teachers, or everyone needs to work together to get out of this, this post-pandemic situation that we're in.
You're totally right. Now, if you're involved with the Lighthouse Society, I don't know if that's where I should be directing people to if they want to find out more, or if somebody does want to start exploring all of the different alternative health practitioners that are available. What's the best point of entry? What should they do?
So I don't necessarily know about all the others. There is actually I don't believe that we have a registry of all. I think they're all individual. Like there's a college of acupuncturists. There's a college of naturopathic doctors of Alberta. There would be a college of chiropractors. So there's different colleges that would then list their practitioners and who you could go see. Sometimes it's word of mouth that I usually wind up seeing patients more for word of mouth and not through advertising. Um, I'm trying to think of other ways.
You know what? You've just given me one more thing to work on with this health spending account that I want to put together, because I do want to create it more like an app. Sort of,
Yeah,
I've been thinking about how Uber allows for practitioners to get registered, and then patients or customers to get registered, and then
yeah,
the app just connects them. And so
yeah. I
that could be
actually
another
love
way,
that idea.
actually, of allowing people to find who's taking patients, and maybe even have access to websites so they can do bookings. So I've
Yep.
got a long list of things to do out of
Yes,
our
and I think it's
conversation.
I think it's an excellent system that you've come up with. I was wondering how it would be implicated, and when I read that, I thought, oh, this is an excellent idea. It's so easy with an app to be able to pay for it with your app, or for a practitioner to register for it. And I think that's a wonderful way. And when you have that registry as well, if the practitioners choose to, they might opt in to a kind of advertising umbrella, to kind of say, I want to be part of the directory that's in here as well, so people can actually see what and who is available under this
Wow. Okay. The possibilities are endless. This is what I
Mhm.
love about technology and innovation is that you start with one small idea and it is going to blossom. And I can't wait to work with you on this. Thank you so much
Yeah,
for the
thank
education
you.
today. I sure appreciate your time.
Thank you so much.
You bet. That was Christine Perkins. As I mentioned, she is a naturopathic doctor, which has been regulated in our province since she says 2012. So we are going to make sure that as we get into the fall respiratory virus season, you are armed with all the information that you need to keep yourself well. And I hope that you understand a little bit more about what I'm trying to achieve with my proposal for health spending accounts. If you've got some other thoughts on that or other practitioners that you think I should interview and talk to or consider in how we're rolling this out, if I get elected on October the 6th, I'm telling you, my friends, we're going to try to find a way to implement this very quickly because I think it's going to be even more important as we go forward over the next number of years, as we're dealing with a mental health crisis, dealing with some of the legacy issues from the last 2 years. Just put more power in your hands to be able to take care of yourself, give a little bit of self-care. And I'm Danielle Smith. If you want to join my team, you can go to daniellesmith.ca, buy a membership, and we'll be looking forward to not only leading the country in this discussion, but generally speaking, putting Alberta first. Thanks so much for tuning in.